Today in the news, restaurants and retailers lead Texas's slow reboot set for May 1st. Costs make nearly 1 in 10 adults leery of seeking COVID care, and a Dallas priest is accused of abuse and removed from the ministry. Today is April 30th, 2020, and this is Dallas Weekly News. Hello, I'm your host, Patrick Washington, and this is Dallas Weekly News. Governor Greg Abbott outlined Monday a slow reopening of the Texas economy that is among the largest in the world, allowing restaurants, retailers, movie theaters, and malls to start letting customers trickle into their establishments starting Friday. The move comes as Texas and other states process a record high surge in jobless claims. Food banks are seeing spiking demands, and testing for the coronavirus remains limited. Conservatives and supporters of President Donald Trump have amplified calls to get the state and country back to work, while leaders of Texas's biggest cities, who are mostly Democrats, have urged a slower course. Abbott's plan allows establishments to let in customers up to 25% of capacity as long as they follow social distancing guidelines. Those in counties that have reported fewer than 5 cases of the coronavirus will be able to serve customers at a 50% threshold unless officials see a spike in new cases. Abbott also said he will let his month-long stay-at-home order expire on April 30th. Bars, barbershops, hair salons, and gyms remain closed, as do universities and schools for more than 5 million children. Abbott has been under some pressure for a quicker reopening, but chose a cautious route intended to avoid a spike in new cases. Abbott said his order on business capacity can be enforced through fines or threats of 180 days in jail for business owners for violations, or a regulated business could lose their license to operate. Abbott's new order also means cities like Houston and Austin, which have required people to wear masks in public, cannot punish any violators with penalties. However, Abbott urged people to continue wearing masks and said anyone still nervous about going out in the public should stay home. A key part of Abbott's plan is a promise of boosting testing and tracking outbreaks, including building a team of 4,000 contact tracers by May 11th. The new rules could be expanded to more businesses if the next 2 weeks do not show sharp increases in the number of people hospitalized or dying from COVID-19. In a series of radio and television interviews last week, Abbott assured that life would get started back to normal in May, promising both a strategic approach along with hints of a massive reopening. But the plan outlined Monday is a more cautious approach that some other states have taken, with promise of a greater expansion if things go well. Georgia Governor Brian Kemp's aggressive moves last week to reopen that state left many business owners confused and drew rare rebukes from conservatives, including Trump, that it was too much, too fast. Americans remain overwhelmingly in favor of stay-at-home orders and other efforts that slow the spread of the coronavirus, according to a survey from the Associated Press NORC Center for Public Affairs Research. A majority of Americans also say it won't be safe to lift social distancing guidelines anytime soon. According to state health officials, Texas had more than 25,200 confirmed cases of COVID-19 as of Monday, with 663 deaths and more than 11,100 deemed recovered. The number of infections is likely higher because many people have not been tested, and studies suggest people can be infected and not feel sick. For most people, the new coronavirus causes mild or moderate symptoms that clear up within a few weeks. For some, especially older adults and those with existing health problems, it can cause more severe illness and be life-threatening. As states gear up to reopen, a poll finds potential obstacle to controlling the coronavirus. Nearly 1 in 10 adults say costs would keep them from seeking help if they thought they were infected. The Gallup West Healthcare Cost Survey, out Tuesday, finds that 9% of those age 18 and older would avoid seeking treatment because of concerns about the cost of care, even if they thought they were infected with the coronavirus. A significantly higher number, 14%, would avoid seeking treatment because of financial worries if they had fever and a dry cough, two widely publicized symptoms of COVID-19. Although Congress and President Donald Trump have made coronavirus testing free to patients, and some insurers are waiving copays and deductibles for treatment within their networks, the survey suggests such messages may not be getting to the public. Experts say that to succeed, the nation's reopening has to be based on 3 pillars: testing, tracing those who came in contact with infected people, and treatment for those who become ill. If people who may be sick are reluctant to come forward, that could create a blind spot for governors and public health officials trying to collaborate reopening plans to quickly contain potential virus flare-ups. The survey found that members of minority groups, younger people, those with less than a college degree, and people making less than $40,000 a year were more likely to say they would avoid treatment for economic reasons. 14% of non-white poll respondents said they would avoid treatment even if they suspected they had the coronavirus, compared with the 6% of whites citing the cost. Yet COVID-19 has proven to be more lethal among blacks and Hispanics, a grim phenomenon linked to higher rates of underlying diseases such as diabetes, lower rates of health insurance coverage, and healthcare discrimination practices. Among age groups, the survey found those 18 to 29 were the most likely to avoid treatment. Although COVID-19 claims a disproportionately high share of victims among older people, there's plenty of evidence that seemingly healthy young adults can also get sick very quickly. In the poll, 12% of those 18 to 29 said they would avoid treatment because of cost worries. Adults ages 50 to 64 were the least likely to avoid care, with only 3% citing pocketbook issues as a barrier. Surprisingly, 7% of those 65 and older said cost would be an issue for them. Virtually all U.S. seniors are covered by Medicare, and many have additional protections for out-of-pocket expenses. The poll also found income was a dividing line in Americans' attitudes. Only 3% of those making $100,000 or more cited cost as a barrier to COVID care, compared to 14% of those earning under $40,000. Dallas Roman Catholic Diocese has removed a priest from the ministry after sexual abuse allegations arose in the Colombian Archdiocese where he formerly served. The Dallas Morning News reported a priest, Oscar Mora, was among 19 suspended last month by the Catholic Archdiocese of Villavicencio after the allegation arose earlier this year. The Archdiocese alerted Bishop Edward Burns in Dallas that one of the priests in the Dallas Diocese was among the 19 suspended. Jaime Garcia, Mora's Colombian attorney, told the newspaper that the priest denies the allegation. Dallas Diocese spokeswoman Annette Taylor told the newspaper that Mora was assigned to the Divine Mercy of Our Lord Catholic Church in Mesquite and the Cathedral Santuario de Guadalupe in downtown Dallas. This has been Dallas Weekly News. I am your host, Patrick Washington. It's April 30th. Once again, you can find these and more stories at dallasweekly.com and follow us on social media on Facebook, Instagram, YouTube, and Twitter. Stay home, stay safe, and we'll see you tomorrow.